It's a problem around the world and in Trinidad and Tobago.
CNCDs have been responsible for 4 of the 5 leading causes of death in our country over the last 2 decades, and heart disease, cancers, diabetes, and strokes account for 60% of the total causes of death in our country.
Minister Nares points to World Health Organization figures showing that trans fatty acids increase the risk of non-communicable chronic diseases and that it does not discriminate by age.
Childhood obesity is on the increase, leading to the onset of diabetes and other chronic diseases much earlier in life. This epi-transition is visibly a result of the shift in dietary patterns.
A recent survey by Kariri, he says, showed that 24% of primary and secondary school students are overweight or obese, and there's a link between salty foods and obesity in children.
As foods with a high salt content cause thirst, and children are likely to reach for high-calorie soft drinks to quench their thirst.
The minister says the modifiable risk factors must be controlled to ensure maximum protection.
They include tobacco use, which, as you know, the government is making efforts. In fact, we have successfully been able to introduce tobacco control, unhealthy diet, physical activity, and abuse of alcohol.
The minister says while the ministry can take regulatory action to reduce fatty acids and salt in foods, the chosen route is cooperation with the business sector to bring this about.